Assalamualaikum and hello everyone, my name is Nur Husna, binti Abd Ghani and I am a medical physics student in School of Physics, University Science Malaysia. In this video, I would like to talk about 4D ultrasounds or monitoring heart failure disease. Let's get started. First of all, I want to introduce to you what is 4D ultrasounds. I'm sure you have heard about ultrasounds or sonography before. 4D ultrasounds is advanced ultrasounds or sonography, which is non-invasive imaging method that use high frequency sound wave, which is above of threshold of human hearing, to create a live video structure inside of body. The 4D ultrasound produces real-time 3D image and videos of organ inside of body. Specific type 4D ultrasounds that use in monitoring heart is 4D echocardiography, which can create a moving image of the heart, or known as echocardiogram. From the echocardiogram, we can see the movement of valve, size of chamber, size of aortic root, thickness of wall, and function of ventricle. These informations allow cardiologists to diagnose heart disease. Now we jump into heart failure disease. When we hear about heart failure, the first come to our mind is heart stop working. However, heart failure is an illness in which pumping action of heart become less and less powerful, and the body tissue are temporarily not receiving enough blood and also oxygen. There are several types of heart failure. The first type is left side heart failure. The left side heart failure can divide by heart failure with reduced ejection fractions or systolic failure, where the left ventricle loses its ability to contract normally. Thus, the heart can pump with enough force to push enough blood into circulation. Heart failure with a perceived ejection fractions or diastolic failure, where the left ventricle loses its ability to relax normally because the muscle has become stiff, hence the heart can properly fill the blood during resting period between each beat. The second type of heart failure is right side heart failure. Right side heart failure usually occurs as a result of left side heart failure. What happens is the right ventricle has lost its ability to pump. That means the heart can fill with enough blood and force blood back into the vein. For the echocardiography play an important role in closely monitoring the heart functions, especially helpful for patients with a pacemaker implant, because a 4D echogram can show how bad the heart failure and the type of the heart failure. The way of 4D echocardiography works is similar with the general echocardiography, and they work along with the electrocardiography or ECG. The imaging technique is start from transducer or ultrasound probe. Did you know inside the probe consists of many of piezoelectric crystal? The piezoelectric crystal is used to change the electrical pulse from the power supply into the ultrasound wave. Then the ultrasound is sent into the chest and receives the reflection of the wave of the various parts of the heart. The reflections of waves are called as echoes are converted back into electrical pulse by the crystals. Then a computer assembles the electrical pulse that comes from the echoes to create an image of the heart. This image appears on monitor screens, may be recorded or printed for reviewing by the cardiologist. The differences of 4D echocardiography with the general one is 4D echocardiography imaging system consists of rotating and linear mechanical 3D probe. The sequence of image can be acquired at 12.5 frames per second and reconstruct immediately. The mechanical 3D probe are made compactly and they are convenient to operate. though they are comparatively larger than the conventional linear probe. The needed image and reconstruction time is short, which enables viewing high-quality 3D image in real time. And by moving the transducer to various positions on the chest can result in different structure of the heart. The advantages of 4D echocardiography is producing high-resolution image of the heart compared to 2D echocardiography and generating image in short period. However, the disadvantages of 4D echocardiography is producing image with low frame rates and images are limited to anatomical criteria like obesity. As conclusion, the 4D echocardiography is one of useful methods to monitor and detect heart failure, as it's safe to use and produce 4D detailed image of the heart in short time. That's all from me. Thank you.